So welcome everyone to our today's lunch at SARAVYC, and today is a special guest lecture also because we are joined by Dr. Stoddard, who we are lucky that she's our visiting faculty at SARAVYC for a few months. And I am happy to introduce Sarah. She's a recognized leader in adolescent health, and she's an associate professor at the University of Michigan. Her work focuses on how we can better support youth well-being, especially for young people facing social and health inequities. And today she'll be speaking about strengths-based approaches to preventing youth substance use with a focus on how hope, purpose, and future thinking can help shape healthier futures. She'll also be sharing youth empowerment solutions for positive futures, or YES PF, which is an empowerment-based program for students showing early signs of school disengagement. Um, and so before I start, I also wanted to acknowledge that we are coming today from University of British Columbia, which is located on the unceded territory of Coast Salish peoples, including the territories of Musqueam, Squamish, Tsleil-Waututh, and Chemainus nations. I would also like to acknowledge all the different lands that our SARAVYC works takes place. With that, I will hand it over to Dr. Stoddard. Thank you so much.
Sorry, so many buttons. I hope you can see my slides. Okay. Yep, I
Yes.
got a thumbs up. Okay, great. Thank you so much, Monica, for the introduction. And thank you to Elizabeth Sawick and others here at the University of British Columbia for kind of hosting me and arranging for kind of supporting my being able to be here for the past couple months and into the future for a little bit longer. So I am going to talk just about, it's just really a segment of my work. I usually like to share a lot more about my background, but we have a short amount of time. And so I'm going to try to go kind of quickly through some of that. I am a nurse by training, really a public health nurse. I have never worked in the hospital system. And pretty much all of my work has been with youth in predominantly low income, low resource communities. So I really come with both a practice perspective of that, working with young people in their homes and in their communities, and then now as more of a researcher in that space. Let's see. So my program of research really has some kind of multiple facets to it, as many people's, I think, do. For the most part, the majority of my work really takes a strengths-based approach. So more or less, I'm looking for opportunities to prevent some of the behavioral health conditions that I'll talk about, but from a lens of not looking at problems, but maybe trying to look at assets, resources, opportunities to really prevent some of the behavioral health conditions that I've focused on. Most of my work has either been substance use and misuse, interpersonal violence and aggression, and that includes community violence, and more recently some around mental health. And I've looked really both at the etiology of those kind of outcomes for more vulnerable youth, and like I said, opportunities for prevention. And then a good part of my work has been about looking at place-based characteristics. So conditions of daily living. In the US, I am from the States. I will acknowledge that too. And everything I'm going to share with you really comes from kind of the United States. But right now, social determinants of health is not exactly the best terms to use around funding in particular. And it's a little bit more politically charged. We speak more about conditions of daily living and things within people's context of life and how that influences their health and well-being. And For place-based characteristics, I've really looked at both the etiology, so how neighborhoods impact health and health outcomes, and ways to intervene at an environmental level. And I've also been part of some multi-level interventions for both violence and substance use. I'm really not going to talk about much of that today, although the intervention I'm going to talk about is about the school setting and changing the environment, in the school setting. So I'm going to touch a little bit on, I'm going to talk really about one intervention in particular, but I'm going to talk a little bit of background to give you a little bit of context, talk about some previous work of mine that led to kind of that intervention, and share that intervention with you. So all of my work and really my thinking is grounded in the socio-ecological model. Most of you, many of you probably recognize this. It's the idea that the individual, and for me, it's typically the individual adolescent, is embedded within its environment in a sense. And there's concentric rings of kind of levels of influence, with things that are maybe most closely influencing the young person in that most kind of center circle around the person. So that's family, peers. And then as you go out, it's maybe a little bit more removed from directly, maybe impacting the young person, but they still are things that impact health and well-being. So things like policies, neighborhood conditions, those things all also impact the young person. So I always think of everything kind of within this framework. And then what I like about this model that I kind of drew here is that it does include time, or the chronos system, which means, and for me, because I work with young people, I always think about what they've experienced in the past influences their present, and what they're experiencing now influences their future. And so that is an aspect of Brafenbrenner's work that really, I think, came out later in some of his kind of theory development. But for me, that's very important, I think, because of the developmental stage that I also work in. Within the system, then, I've already mentioned strength-based approaches. So you can look at things and think about things that are both risk, or that might contribute negatively to somebody's health or well-being. Or you can also look, though, at strengths or assets, resources, things that might contribute in a positive way. And like I said, I typically look at both. A lot of the intervention work I do looks at strengths. So I'm going to talk more specifically today about future orientation. And this is where I've spent quite a bit of my career at an individual level, and thinking about kind of opportunities for building strengths and building assets in young people. So future orientation is an individual's thoughts or feelings about their future. I think of it as multi-dimension, in that it's about someone's motivations, their cognition and how they think about it, but then also their behavior. We know from other researchers as well that future orientation is key for motivation related to both academics and kind of non-academic domains. I've also looked at other relative or related concepts of possible selves, future expectations, hope, purpose, meaning, and perceived control of their future. To me, and we're not going to get into a big kind of conceptual discussion about future orientation, but like I said, I see it as multidimensional, and it incorporates many of these other concepts in it from my perspective. So what do we know about future orientation, and some of the things that I'm going to kind of talk about coming up? So alcohol and drug use. From my own work and other people's work, we do know that there's a relationship between future orientation and alcohol and drug use, kind of attitudes, intentions, behaviors. So this is a study I did of high school students. We did find that future orientation was associated with stronger intentions to avoid alcohol and drug use, higher perceived control over use, less positive expectancies about using alcohol or drugs, and then actually less use in the past 30 days, that self-reported use. Others, like I said, have also looked at future orientation and aspirations and have found it lowered intentions to use alcohol, and in some of our also often more vulnerable populations of youth. I had also found that it was associated with less non-medical use of prescription drugs in adolescents as well. I have looked at and thought some about the timing and development of future orientation during adolescence. One thing I have found that in looking at possible selves, that there's a higher fear of academic failure as that middle age group gets older. So when comparing 6th, 7th, and 8th graders, I found higher levels of fear of academic failure in 8th graders compared to kind of younger middle school students. And then from my work and others, we know that things within their context, their peers, families, schools, and communities can influence expectations for the future. So I bring all that together to kind of thinking about kind of the connection when I'm going to talk about, kind of future orientation and kind of thinking about alcohol and drug use, but then also thinking about school and particular specific young people within kind of that school-aged group. So I really became interested in school disengaged youth. So those are kids that already in middle school are behind for grade for age. They might be having high absenteeism or chronic absenteeism, failing grades, other kind of school-related concerns already in kind of middle school ages, so in 5th, 6th, 7th grade. And we know that young people who have those early warning signs or are disengaged at that point are more likely to discontinue school or leave school before graduation. There's also been some links to, I'm going to talk about summer school, that kids that are in summer school also are more likely to leave school prior to graduation. So I looked at in a study, this is a national survey with over 110,000 8th graders. Dr. Veliz and I looked at the relationship between summer school attendance, school disengagement, and substance use. And we found that school disengagement and substance use were both associated with summer school attendance. And then we also found that youth with the highest propensity to use substances were also in summer school. So we really kind of took this also as thinking that, this might be an opportunity to reach a group of young people that are at higher risk for both school disengagement and school dropout, but also for substance use. So kind of taking this all together, middle school years may be a critical time for prevention activities, and our findings really pointed to summer school as a potential opportunity to reach a group of highly disengaged youth that are really at risk for substance use. And that, there's the potential that programs that enhance a connection to school and prevent problematic drug and alcohol use may be particularly beneficial for these young people. So I'm going to talk about youth empowerment solutions for positive futures. So I have to start though by talking about the original youth empowerment solutions. So this original intervention was developed by my mentor, Mark Zimmerman, and it was in partnership with youth serving organization in Flint, and it was Michigan. So I'm not going to go Flint, Michigan. If you don't know of Flint, it is about an hour outside of Detroit. It was a highly manufacturing auto industry community in the 70s, 80s. In kind of 80s, 90s, manufacturing really dropped. And there was a lot of then unemployment and lack of jobs for people who had been in those roles. And Flint, which was very much a prospering community, took really a negative turn and had some of the highest rates of violence and crime in the country, actually, in the 90s and 2000s. Flint, the main core of Flint is predominantly African American, Black community, and we were seeing particularly really negative outcomes for young people growing up there. So Mark partnered with a youth serving organization in Flint and developed youth empowerment solutions really geared towards Black youth. It's an active learning curriculum designed to help youth build skills, confidence in themselves, and to develop intergenerational partnerships, provide opportunities for participants to use skills to affect community change. So the idea behind it was thinking about the community violence going on and how could we maybe help young people see themselves in positive ways and that they had opportunities to make positive change in their community. So that was Youth Empowerment Solutions, the original. So it's grounded in empowerment theory, which incorporates the notion that health promotion requires not only that youth develop specific skills and positive assets, but also that they become motivated to actively apply these skills and knowledge to become agents of positive change for themselves and in their communities. So empowerment theory really focuses on the process to engage individuals in activities that help them develop confidence, skills, and behavioral strategies to achieve self-identified goals. So then the idea behind YES was that these empowering processes may be developed through participation in an empowerment-based intervention would lead to the empowerment outcomes, school achievement, pro-social involvement, and kind of positive outcomes for youth of reductions in violent and aggressive behaviors. So really the idea then is to get youth to think, feel, and do, and to be proactive in ways that might produce healthier outcomes for themselves and their community. So I was interested, so I became a postdoc during this time. He was already running YES as an after-school program for 7th graders in several of the schools in Flint and in the kind of Genesee County, the surrounding Flint area. So I came in, started working on YES with him. We started doing some other adaptations of YES. Like I said, this original version was very much geared towards Black youth. Many of the schools around Flint, while predominantly Black, also we were seeing more diversity in race ethnicity. So we modified it to do more of a multicultural version of it. And then we also were starting to work on a intimate partner violence version of it, or like a dating violence version of it with some colleagues in Detroit. So, but I got thinking, all of these things might help substance use. And is there other, kind of outcomes as well, aside from violence? So I did an analysis. This is data from a multi-site sample of youth participating in after-school programs. And there were measures of indicators of empowerment in it, along with substance use intentions and school outcomes. And I found that indicators of empowerment were associated with future expectations, and that empowerment had an indirect effect on substance use intentions and school disciplinary action through future expectations. And that was measured 6 months after the empowerment indicators. So for me, it pointed to the idea also that future expectations may be a mechanism by which empowerment could contribute to decreased substance use intentions and behaviors that were problematic in the school setting. So I adapted the original yes to be Youth Empowerment Solution for Positive Futures. So I did this I maintained the core youth empowerment components, and I'll talk a little bit about what some of those are and some of the activities are. But I decided I wanted to focus it on 6th and 7th graders that were at risk for school disengagement. I incorporated more information and more activities related to future orientation. And I turned it into I say 4 to 6 weeks. Most of the schools I've done this with have done it in about 5 to 6 weeks, a summer enrichment program where the students participate 4 days a week, 4 hours a day for 5 to 6 weeks over the summer. I deliver it through using trained facilitators. So the school selects the facilitators and they hire them, and then I train them. And typically they're either teachers, social workers, or paraprofessionals that are already engaged at the school. So the goals of the Yes for Positive Futures is to empower youth to change their school and community, to create positive settings for youth to develop, to help form positive relationships between youth and adults. And in this case, most of the adults are kind of teachers and school personnel. And then with the idea that this would have long-term goals in changing things about maybe the school or community that contribute to either hopelessness, kind of negative feelings about school and school disengagement. My hope is that it would promote attitudes that support school and community participation, and that it would promote school success and completion, and in the end, prevent alcohol and drug misuse. So yes, focuses on the idea that health promotion requires youth to have skills and assets, and that they become motivated to apply these skills. So there are, the curriculum has 5 components, but it is very interactive, and I'll show you some things coming up. But some of the content is related to building youth as leaders. Students learn more about their school community. They actually do a needs assessment of their school community. They look at both strengths and weaknesses at their school. So things that maybe make school feel welcoming, that makes, so kind of positive things about school, but then what are things about their school community that maybe make it feel less welcoming or unsafe, or that might contribute to, like in our thinking, substance use, or to students not wanting to come to school. And then there's a component on building partnerships and planning for change. So the students do, and I'll show you there's an action plan and then reflection and celebration. So the building partnerships and planning for change, and the action is that the students, after they do a needs assessment, they identify in small groups, so they're in small groups for this, they identify a community change project that they want to do, that through their needs assessment that they think will contribute to making school more welcoming, making school feel safer, and they write a proposal. They have a budget, and they have to kind of put together what it would cost to implement the project that they want to complete. And then they present it in front of school personnel. They get it approved, and then the last couple of weeks of their summer program is the action, and they implement their change project. So students have done all kinds of different things. Like I said, here's a few things from kind of just images from kind of the activities and curriculum. So it is interactive. I have tailored it that There's activities that are thinking about themselves. So like when we talk about setting goals for their project, so we talk about setting goals for the project, which they do kind of as thinking about as a group. And then at the same time, we also talk about setting personal goals. And so the whole curriculum is kind of this parallel. How do I apply it to myself? But then how do I apply it to my project or kind of in a group setting? So they they get this experience of trying to like I said, come up with a project and implement the project. It is all very much youth led, adult supported. So these are students. Now, sometimes the adults have to help them realize what's a realistic project. Everyone wants to fix the bathrooms or change the bathrooms, and that's not always possible. But really, it is meant to be an adult or a student-driven projects. Here's pictures of projects. So they have done community gardens, fixing up outside spaces. This school had benches that had been donated, and they looked really bad. And so the students really wanted to clean those up, and then they painted motivational sayings on the back of the benches. This was another bench project that they cleaned up the benches and painted them and made it a space outside that students could gather. So they've done a lot of different kinds of projects over the years. So quickly, because I knew I was going to be close on time. So I just wanted to talk a little bit about outcomes. So I have run this a couple different times. I'm going to share outcomes from one of the times. It was a pre-post intervention where I collected self-report baseline and then post-intervention at 3 months and 6 months. The students receive a small financial incentive. I've done a couple different ways for incentivizing participation. I'm happy to talk about that later if anyone's interested. Inclusion is these were students who were identified as having early warning signs for school dropout or school disengagement. The school identified the students and then provided them information about the program. And then if they were interested, they could sign up, and I was available to talk to them about the program if they had questions. I kind of already talked about this. So like I mentioned, we did have to get parent consent, and I did get youth assent. And then students participated 4 hours a day, four days a week for 5 weeks, delivered by trained facilitators. I did also offer busing for students who lived in their usual busing area. So some students could walk to school, others, if they needed busing, they got busing, and then they all got lunch as part of it. Which for many kids, these are low resource communities, high poverty areas. And so for many kids, having lunch is important in the summer too. So this study focused on 2 different school districts. I enrolled 67 students and 55 students showed up to complete baseline on the first day of school. So here's some things we can talk about and think about. I over-enroll purposely because sometimes it is hard to get students to come. What I found though is once students got there for a couple days, they stayed. So I didn't, after, kind of that first week, I had very little attrition. 42% are female. You can see the breakdown for grade. It was a pretty diverse set of students. And 51 students then out of the 55 completed the first post-test, and 52 completed the second post-test. I didn't require that they had to do the first one to do the second one. So this is the conceptual model. I'm going to use this really quickly to talk about measures. So I measured, of course, a variety of things to capture these different larger constructs. So for psychological empowerment, for interpersonal I looked at self-esteem, civic engagement, leadership efficacy, interpersonal included adults as resources, behavior included leadership behavior, future orientation. We looked at perceived control over the future, future expectancies, outcomes, looked at pro-social behavior, school outcomes like engagement, attitudes, beliefs, and then substance use. I looked at a lot of precursors of use. I think we need to remember that these are 6th, 7th, and 8th graders, and while they are at higher risk, use is still very, very low at this point. So I really was looking more at norms, perceived control, those kinds of things. It was a small sample, so much of what I'm going to share is what we do for small samples. So we did pair t-tests and looked at Cohen's d, which you can assess effect size even with smaller samples. So I am only showing you the constructs that were significant, and you can see that all had small effect sizes, but I think this is good for the sample size that we had, that we were seeing the effect sizes that we did. So there are several limitations. Of course, this was specific to just a couple school districts. The sample size was small. I really had wanted to follow this group longer, and then COVID happened, and all of that kind of fell apart as far as trying to follow them longer. But this was promising to me that the findings really did suggest that this type of intervention was supporting kind of the assets that we were hoping it would, and has the potential to reduce substance use and support school engagement. Whoop. I do need to thank, I was funded by NIDA, the National Institute of Drug Abuse, for a lot of that work and for the development of the intervention, along with some funding through the university. And then I'd like to thank the students and the school personnel who have, really contributed to many of the studies probably that I shared, not just the single final intervention study that I mentioned. I have lots of references if anyone's interested, and there's my contact information if you'd like more, and I apologize for going over. But I'm happy to take questions.
Yeah. Thank you, Sarah. I know we have gone past time, but how can we not? You have just shared such an amazing work with us, and it's so difficult to squeeze that in within those 20 minutes. So thank you so much. We are very grateful for sharing your work with us. So yeah, and if the folks who have joined us, if you can stay with us, we are happy to take questions. And if you want to type in the chat box, yeah, I can pass it on to Sarah. But yeah, if you have any questions, please go ahead. We have a lot of thank yous in the chat box.
He shared this. Yeah, sorry. Part of me shared this because I do think the youth empowerment solutions, the foundation, which is that kind of building leadership skills, building self-efficacy, looking at the community, whatever that might look like, and thinking about change projects and youth as drivers of change. I think it's applicable to a lot of different kind of topics or settings. Like I said, we've done it. I did it, that was very focused in school. The community change projects that Mark did in the original one were focused on neighborhoods and making neighborhoods less conducive to violence. So I think it could be applied, and the kind of the foundation of it applied to different topics and in different ways. So that was part of my thinking about sharing it, was just some of the other interests in, I think, through SARAVYC, and maybe how that idea could be applied different ways.
Yeah, Elizabeth, go ahead, please.
I'm also reminded of some other projects that Emily Jenkins has done. In fact, Her dissertation, I was on her committee, was about actually mobilizing youth in a small rural northern Fort St. James around developing um, uh, resources. They called it Sonar. They created a resource for youth to like identify services and supports for each other, and rolled it out in that community. And then, she has since identified civic engagement activities as ways of supporting mental health and mental health outcomes for young people. And so that's been a longstanding part of, oh yeah, Zach said, similar to Emily's work and the Wellstream work, which is focused around substance use and mental health and that sort of civic engagement and empowerment work. And I think that's and likewise our work with McCreary Center Society, where there is both these uh, youth action grants where youth who are able to who've been part of the regions where the adolescent health survey is done can propose projects to enhance or address health issues in their community, and then they get mentored in how to actually like create that proposal and then how to like do it and those kinds of pieces. And so that ability to like, I don't think either of like the things that we've done have had that level of intensity, 4 hours a day, 4 days a week, for 5 weeks kind of approach. But I also know sort of an equivalent thing, the Youth Research Academy at McCreary, where youth who are from foster care actually come and as part of learning research and doing research about their community and the things that they want to prioritize, develop skills and develop a variety of supports. And it really is an empowerment kind of approach to it. So it's great to see that there is both similarities, and I really appreciate the discussion of measures and measurement and how you went about actually designing this, because that's the really important like gold ring about all of this is how do you actually document the evidence that these kinds of approaches to empowerment, positive youth development, youth engagement actually have positive impacts for young people that we can measure and can document. And in some cases, those improvements are actually better than years of therapy or prescription medications. So
Yeah, the summer school came from my community partners or my school partners. And I was looking for kind of a way to think about doing an intervention and coming in during the school day is really hard often. The schools have their own goals and that's more around education. And so, finding time during the school day is often hard, but they had said to me, well, what about summer? Because like for these kids, often they're too old for childcare or daycare, but they maybe shouldn't have so much free time alone during the day. And they were like, parents are often looking for things for their kids to do during the day and during the summer. And so that was kind of how this came out, was through kind of them identifying this is something the schools could use, that they don't have resources, to offer this as well, at least in the States or where I am. So, it was kind of, so some of the intensity was also related, I think, to, having giving kids something positive to do. But we also had a curriculum that really was intended to try to build some skills and kind of assets in kids as well. So, yeah.
great, thanks.
Yeah, Zach.
Do this, I always forget. Thank you for the talk. I had a question kind of building on the measurement comment, and it's
Mhm.
something I've been wondering about, just sort of if this initiative or other kind of similar ones.
Yeah.
Um, I'm not sure how to phrase this the question. I'll do my best. How to go about assessing them in ways which are rigorous but are also sort of fair to the program. So you can think of a lot of measures that are, very validated, but like wouldn't maybe be a good measure to pick because, like, yeah, of course, it's not going to move the dial on this certain measure. That's just not fair for this type of population because, it's not a prescription, it's not therapy. Like, I'm just curious what your thought process was around like picking measures that you felt were like fair, or were there any measures that you thought this is interesting, but actually, even though this is a great program, we don't think it would be reasonable to expect it to move the dial. But sorry, this is very,
Yeah, yeah, and I think, and I think I kind of just touched on that quickly with some of the actual behaviors, because at least for this age group and in this period of time, you're not going to see changes in substance use behaviors, because not necessarily, at least unless you had a really huge sample and really a sample that was already using, then maybe you would. But like this group of kids, I think I maybe had a handful that actually said that they had used substances and like in the past year, right? And so, they've used once in the past year. So, I mean, I think depending on your population, those are hard. And it's really hard to also say, well, they're in where I think I'm going to see outcomes are probably in high school. But that's for some of these kids 4 years away, 5 years away. So our grant funding mechanisms also don't often help with that either as much. It's not a long enough time period. So that's why I've chosen more things around attitudes, norms, kind of precursors of the behavior. So I've done that. A lot of the empowerment measures in particular, I took from my mentors. And, he's done that for many years. And so had, I think, also kind of gone through, done some measurement work. He is very also much about not over asking for measures. We do not give, when I work with Mark, we will not do a battery of 20 items for any one single construct, or, there's just no way. So, he says 3 to 4 items. You want to measure something, you get 3 to 4 items. Good or bad, but I think, we've taken some bigger scales at times and really have looked at the items and how is it contributing and what's contributing. So we've done some shrinking of measures or of scales to try to capture it in a smaller number of items. But I think it is some trial and error too. What does show up or not? And right, it may not be, it may be that you're just not capturing it with your items or with the measures the way you want it to. I've had a harder time. I will share with future orientation. I have put different measures on at different times and not really captured what I think I wanted. There's some that I found do a better job now, but that one's been one that's been harder.
Okay, thanks. Yeah, that was something I've been wondering a lot. So very helpful. Thank you.
Yeah. And some measures are just really labor intensive too, and you have to decide how much you want to do or want the kid to do.
I have a follow-up question about that, but I
Yeah,
want to cede the floor if anyone.
I think you can go.
So you sort of touched on in your response to this idea that I've also been around like ceiling effects with these measures, where like
Yeah.
if the cohort is coming in and doing, I'm going to use air quotes here, like very well on certain things,
Mhm.
uh, it can sort of penalize the assessment of the program because there's literally only one way. Yeah, so just did you ever have any issues with that, like ceiling effects, especially where people can look at the scale and kind of guess like the social desirability? Yeah, I should probably say this, not this.
Yeah, and I think that is maybe sometimes why we don't see, or I'll see it gets a little bit negative. It's like, really? That shouldn't have gone down. But again, it was so positive that there was no, it was all still. So yes, I have had that experience, and I do think that's a little hard, right? It's hard, you want, and with the kids too, you want them to have some of these positive things anyway without maybe whatever I'm trying to do. And then, right, but our measures don't quite, they're not sensitive maybe in the right way to capture change or yeah, but yeah, yes, and I don't have an answer to that either. But it is hard, and I do think that's why, and maybe that's with sample size too, why I didn't see enough change in some of these to really have big effects. Because some were high to begin with or higher to begin with, and so there wasn't that much room. And so even a little bit of a positive change, doesn't show up right the same way. Yeah.
Gilbert, I'm in Montreal. Nice to meet you.
Nice to meet you.
Hello, everyone that I know. I'm always thinking about intersectionality when something like that happens, and the young as the young youthness being young.
Mm-hmm.
How does it work? How do they react? Are they used to establish something as a kind of me as a different person of others and things like that? How do they deal with that?
Interesting.
Because they are at an age where they see a lot of difference. Intersectionality is a way to introduce this kind of resilience and also being affected by several things, but also your social conditions into that. And of course, you have the display of colors of all kind of colors, I would say.
Yeah.
Not only skin colors or anything ethnic, but that's there's probably a challenge both for the child, but also for the people intervening to don't make it kind of you against others, but to celebrate this intersectionality as a empowerment process.
Yeah. And I would say, and this may be just my experience or my experience with some other groups that I've, kind of observed and been with the program, is they seem to take on some of that and more of that without prompting in a way, or more that openness and that wanting to be accepting of other students. That actually struck me. One of the first couple years of doing it were the projects that they identified. Because like I said, we don't tell them what project to choose. But yet many of the projects that they are choosing are really very much inclusive projects, or and thinking about wanting to make school inclusive in many ways, right? Or for a lot of different kids. But no, that's really interesting to think about more about kind of the intersectionality of that, within that and within that group. Yeah. No, thank you for your question.
Pleasure.
Yeah, I think great conversations. And thanks again, Sarah. And thank you everyone for joining us, staying over time with us. And we will see you next month for our lunch at SARAVYC. Have a great rest of your day. Thank you. Bye.
Thank you. That was a pleasure, but I have to leave. Bye-bye.
Bye.